Namaskar, I'm Dr. Marzieh Alimohammadi. This is my video presentation in an international congress on cosmetology and plastic surgery. The title of my presentation is Report of a Successful Diode Laser Treatment for Intra-Oral Vascular Malformation Lesion. Vascular anomalies characterized by the abnormal development or growth of blood and lymphatic vessels comprise a spectrum of disease that have a wide range of complication and varying severity. Vascular anomalies are classically distinguished according to the classification of Mulliken and Glowacki based on their clinical, histological, and histochemical findings, or hemangiomas and vascular malformations. The difference among vascular anomalies have been widely debated and revisited over the years. Recently, vascular anomalies have been reanalyzed by the International Society for the Study of Vascular Anomalies, or ISSVA, which classified them as vascular tumors and vascular malformations. Vascular tumors may be subclassified as benign, locally aggressive or borderline, and malignant tumors with multiple patterns of histological and clinical manifestations. Vascular malformations are further divided into a simple, combined anomalies of major vessels and syndromic vascular malformations. Simple types are subdivided into slow flow and fast flow type. Slow flow type have venous, lymphatic, and capillary malformations, and simple fast flow malformations have arteriovenous malformations and arteriovenous pustules. Combined type, when two or more vascular malformations type are found in a single lesion. For example, capillary venous malformation, capillary lymphatic malformation, and others. Anomalies of major vessels, also known as channel type or truncal vascular malformations. Syndromic vascular malformations associated with other anomalies. Several treatment options were reported for vascular malformation, which we will discuss further. But now I will give a short explanation about the diode laser. Diode lasers are generally accepted as effective medical devices to treat vascular malformations in the head and neck, as providing a targeted selectivity for oxyhemoglobin, induction of photothermolysis, and electrolytic microagglutination and vessel obliteration. The case we describe in this presentation were treated by using the 810 nanometer diode laser for transmucosal thermocoagulation, or TNT. This is our case. A 56 years old woman with no particular medical and habitual history was referred to the Department of Oral Medicine, School of Dentistry, Shahid Beheshti University of Medical Sciences, for diagnosis and treatment of an intraoral, slowly growing, non-painful, and purplish lesion. The intraoral examination showed a solitary nodular exophytic lesion with a smooth surface, well circumscribed, and in the right side lateral mucosa of the lower lip, which had a firm consistency purple bluish color and 20 mm diameter. Lesion's endoscopy test was partially positive. According to patient's history and clinical examination, the diagnosis of vascular malformation was established. The patient was treated in two sessions, but before, written informed consent was obtained from the patient for publication of this case report and accompanying images. An uninitiated 300 microfiber tips diode laser, Dr. Smile laser at 810 nanometer wavelengths was selected for treatment of the lesion, with an output power of 2 watts in a continuous mode under local anesthesia. Excuse me. In the first session, we worked at a distance of 2 to 3 mm from the surface of the lesion by sweeping it from the center to the periphery approximately for 10 minutes. The lesion started to bleach gradually, and ice cube was used for cooling effect every 30 seconds for about 10 seconds. This effect was able to prevent tissue heating and therefore to control necrosis. We prescribe tetracycline 1% mucosal ointment as medicine to speed up possible wound healing between sessions. The second treatment session was scheduled a week late. In the second session, the lesion regressed slightly and was bleached in the central. We treated it with the same laser setting as the first session, except for the power of the device, which we used 2.5 watts, and also tetracycline 1% mucosal ointment was prescribed, and the patient was followed up after a week. She was reported slightly swelling and soreness at the treatment site, and intra-oral examination showed regression of the lesion with ulcer formation on its surface. We advised the patient to continue using tetracycline ointment and to return 2 weeks later for the next follow-up. Complete mucosal healing was observed after 4 weeks from the first treatment session, without cosmetic complication, and no intra and post-operative bleeding was observed. And finally, the patient was treated, complete healed, and the diode laser has become a frequently used, reliable treatment option for patients presenting vascular malformation of the oral cavity. The most common representative of vascular tumors are hemangiomas. They are characterized by endothelial cell proliferation and angiogenesis, and aren't necessarily present immediately after birth, but may develop in the first few weeks of life and start regressing during puberty or earlier. Two types of hemangiomas, infantile hemangiomas and congenital hemangiomas. uh, are frequent, but infantile hemangiomas are much more frequent than congenital hemangiomas. Infantile hemangiomas about 90% and congenital hemangiomas less than 2%. Infantile hemangiomas tend to grow rapidly in the first few months after birth, before spontaneous regression in early childhood. The characteristic appearance of an infantile hemangioma is the red, raspberry-like skin coloration and different from congenital hemangiomas. Congenital hemangiomas um, differ from infantile hemangiomas as they are fully developed at birth and tend to either regress rapidly or partially or do not regress at all. Vascular tumors are comprised of far more entities than hemangiomas. Based on whether they are malignant or benign, they may require more extensive diagnosis and therapeutic evaluation than hemangiomas. Clinical inspection and patient history are essential for appropriate diagnosis. But vascular malformation are always present at birth, even if asymptomatic, and never regress spontaneously. They may be quiescent for a long time before a mechanical or hormonal stimulus results in their growth. And with increasing size, vascular malformation can cause pain and functional impairment, which may require treatment. Furthermore, it is typical of these lesions to only be localized on one side of the body. As is the situation in our case, the lesion was unilateral. The decision for invasive treatment should be made by an interdisciplinary team and is based on individual symptoms and possible complication of the natural course of the lesion. And the risk of the invasive procedure have to be weighed against the potential benefits. And therapies for vascular anomalies continue to generate a dilemma for oral surgeons. Several treatment options were reported, including conventional surgery, laser surgery, embolization, sclerotherapy, conventional surgeries with the scalpel can be with or without adjunctive preoperative embolization, or drug therapy such as interlesional injection of corticosteroid and interlesional injection of sclerosing agent as a sclerotherapy. But all of these therapeutic approaches carry a high risk of severe side effects such as scars, pain, bleeding, and that's not good at all. And nowadays, advances in the use of laser have all better and effective treatment with minimal side effects. Laser-based treatment have multiple benefits. On the one hand, it is conservative, with no bleeding risk and reduced necessity of anesthesia, faster healing, more precise cutting, less post-operative discomfort due to the biostimulative effects. On the other hand, the procedure has no need for sutures, which is superficial with a bloodless operative field and a relative facility and speed of execution. That is how a patient has been treated by laser. For effective treatment, the laser must penetrate deep into the target vessel. Additionally, the exposure needs to be long enough to cause sufficient coagulation of these vessels. The interaction between laser and tissue is due to the energy absorbed by tissues. For correct treatment of the lesion with high blood content, it is necessary to choose a laser emitting in a wavelength well absorbed by hemoglobin. KTP, diode, NBI, and CO2 are the most effective wavelengths in these cases. Moreover, it is necessary to evaluate many further parameters such as pulse duration, spot size, energy density, that for a correct laser treatment. Shorter pulse duration are preferable for small diameter vessels, while larger pulse duration must be employed in large diameter ones. And the spot size selection should be based according to the depth and the size of the lesion. Finally, the selection of the energy density should be based on the color of the lesion. For example, purple and bluish lesions absorb laser energy more than pink or red ones, requiring for this reason lower fluency. Among the laser techniques, transmucosal thermocoagulation or TNT seems to be the most reliable and advantageous. It is possible to assess that the laser is safe and effective, and in many cases it represents the go-on technique, permitting results usually unattainable with conservative treatments. Among all lasers that have proven surgical capabilities, for example CO2, NBI, KTP, and diode laser, the diode laser is currently the most widely used for surgical excision of proliferative benign or malignant lesion in the oral cavity. This approach avoids perioperative bleeding and reduces the frequency of post-surgical complications, which also happened in our cases. Severe pain, hemorrhaging, scarring, and severe swelling were not observed in our case, and complete healing was noticed in approximately 1 month. The diode laser light turn into heat when absorbed by hemoglobin, and is resulting in coagulation. The penetration depth of the 810 nanometer wavelength appears to be lower than the NBI one, making it more effective in coagulation of superficial and interstitial lesions. As a result, vascular anomalies of small dimensions can easily be treated with diode laser photocoagulation, regardless of the wavelengths. Among all lasers with proven surgical capability, the diode laser is widely used for the surgical excision of proliferative lesions and photocoagulation of small and large vascular malformation in the oral cavity, and for a TNT approach. Along with the good clinical outcomes demonstrated with this report, the diode laser greatly simplifies treatment for the clinician, avoiding the preoperative assessment or modification of the therapy. And preoperative computed tomography, angiography, general anesthesia for lung hospitalization, potential life-threatening and hemorrhagic complications, recurrence, and consequently increasing the acceptability of by patient. And that is our references for this case report, and thanks for your attention, and